Hello, everyone, and welcome. Thank you for joining us in our discussion today on the application of behavioral science in the UN system. My name is Mary McLennan. I lead what's called the UN Behavioral Science Group, which is an initiative of the UN Innovation Network, as well as supported by the Executive Office of the Secretary General. So I'll speak a little bit about the group, but I just wanted to introduce the session for today, where we're talking about behavioral science and misinformation. I also have the honor and pleasure of moderating our discussion. So the UN Behavioral Science Group, for those of you who aren't familiar with our efforts and what we do, we are currently a collection of over 800 UN colleagues from more than 60 entities in 110 countries. So quite a bit of breadth and depth to the group. We obviously range in terms of geographies. We cover domains ranging from health, climate, preventing violent extremism, and also just in different entities and the ways that they function and operate overall as well. So colleagues in the group range from sort of entry-level beginning stages of behavioral science application, exploring how to apply it within the work, through to more experienced actually running projects themselves in a more detailed way, but a lot of colleagues really at that early stages of the journey. So just to flag, no matter where you are along that spectrum, there's a place for you in the UN Behavioral Science Group to learn from others in the system, as well as external partners we engage with, such as those on our panel today. So just to flag a few ways you can engage with behavioral science at the UN if you haven't done so already. So the first is to read the Secretary General's guidance note on the application of behavioral science and the UN Behavioral Science Report. I'll put that in the chat shortly. Some of the links to these documents, they give sort of an overview and context of where the UN is broadly when it comes to behavioral science and some potential directions going forward. Also join the UN Behavioral Science Group. So if you're here, there's a good chance you're already part of the group, but if you haven't, I would encourage you to do so. Obviously, there are UN colleagues who are a part of it, but also colleagues outside the UN can join in an observer role. So feel free to join as well. We have colleagues from other international organizations, academia, governments, as well as NGOs and civil society in the private sector. So really a broad spectrum of potential partners to engage within our work. And then lastly, you can follow us on Twitter to get a more real-time understanding of behavioral science efforts in the UN. Follow us at UN_BSci or UN_innovation if you're interested in innovation more broadly. So that's the group. I'm happy to answer any questions in the chat. My colleague Johanna Yassi is in there as well. She runs the UN Innovation Network in a broader sense. So happy to clarify that. But on to the discussion for today. So just a quick note here about some of the structure and function. We'll be taking questions at the end of this webinar for a number of minutes, and we'll be taking them from the Q&A box. So if you have a question, put it in the box, not in the chat. And you'll also have the opportunity to upvote questions of your colleagues there. So we're really hoping to have this discussion be a meaningful one where we answer questions and discuss topics of interest to most of you in the audience today. So, so please, even if you don't have a question yourself, check out the Q&A box and upvote those that are there. Now on to our speakers. So first we'll hear, I'm just going to introduce them briefly and then we'll go into more later. So first we'll hear from Maher Nasser, who has had a number of years of experience in the UN. He works as a director in the UN Department of Global Communications. So he'll speak to misinformation, disinformation efforts across the UN overall, and some of the importance of it, particularly in the Secretariat, and cover a couple domains there. So he'll kind of situate us within the UN regarding the topic of mis and disinformation more broadly. And then we'll have a panel discussion from colleagues who have a variety of experiences applying behavioral science, as well as addressing the topic of mis and disinformation. So what we'll be doing today is not so much a formal panel presentation, but it'll be a bit more of an informal discussion with these panelists to hear a bit about their perspectives and work. So first, we'll hear from Professor Ralph Hertwig, who's from the Max Planck Institute. So for those of you in the behavioral science community, I'm sure you're familiar with his work, nudges, boosts, and also within the topic of misinformation overall. Next, we'll hear actually from a colleague, Lindsay Gavin, who worked with UNICEF C4D on a project in Kyrgyzstan applying behavioral science to address misinformation. And then as possible, we'll hear from Galina Soludanova, who works with UNICEF in the Kyrgyzstan office, who could provide an interesting perspective on the work there from her standpoint. And then lastly, we'll hear from Pompa DeBroy, who works in the US government's Office of Evaluation Sciences, who again, if you're in the behavioral science community, you're familiar with their work. They've run over 100 evaluations and a lot there to check out. But what she'll be speaking to you today about is some of the work on misinformation that the OES carried out with the Office of the Surgeon General. So with that, I'll stop here and turn it over to Maher for a few comments and opening remarks. Thank you. Over to you.
Well, thank you, Mary, and good morning, good afternoon, colleagues. Good evening. I don't know where you are, but good to be with you, and thank you for including the department in this webinar. People use misinformation, disinformation interchangeably, but they're not the same. Misinformation is false, out of context information that is presented or shared as fact, regardless of the intent to deceive or harm. Disinformation is a subset of misinformation that is intentionally false and is intended to mislead and deceive. At any given point in time, we know from experience that misinformation or disinformation is harmful, but they are particularly so during a pandemic. For societies to properly manage and control a pandemic, people need to follow public health guidance and science-based advice from health authorities and experts. Misinformation and disinformation creates mistrust in institutions and leads to behaviors that delay the ability to contain the virus, as is the case when people did not believe that COVID-19 was real, or that it was just something like the flu, we don't have to take precautions, refused to wear masks when those were mandated or were asked to social distance. And then when the vaccines were developed, became vaccine hesitant or vaccine anti-vaxxers. In several cases, people also traded and shared information about supposedly miracle cures that killed people or family members. In the age of social media, the ability and ease of sharing information with others has amplified the challenge of containing misinformation. What we had in the first year of the pandemic, 2020, was a tsunami of misinformation. Hate, scapegoating. So Secretary General Antonio Guterres asked the department to flood the internet with facts, with science-based advice and calls for solidarity. And that's what we tried to do. We worked with a social impact agency, Purpose, to develop a campaign to do just that. And we launched Verified in the first part of 2020, about in May. It came out as Verified. From the start, it was evident to us that our verified information was not enough to address all of the misinformation outside. We needed to tackle the growing scourge of misinformation around COVID-19, counter vaccine hesitancy, and advocate for solidarity and vaccine equality. We invited people around the world to become information volunteers and built a network of about 70,000 information volunteers who still receive emails from us until now, and hopefully they share them on. Through them and our own channels and platforms and other collaborators, we were able to reach over 1 billion people in 2020. Our approach and strategy were based on amplifying key messages on how to respond to the pandemic based on WHO guidance, but it was delivered in a way that doesn't look like the UN, not in big reports, in a way that is relatable, encouraging people to pause and to take care before they shared information. The campaign was both based on the need to change the way people shared information, i.e. behavioral science. We did not call it behavioral science, but it was effectively what we were looking at. Introducing behavioral changes, a concept later verified by surveys in select countries, that interrupting the emotional urge to share information and introducing a pause moment led to a reduction in sharing of unverified information and encouraged critical thinking. A key tool in countering a flood of misinformation across multiple platforms. That is what we have found. Over the past 2 years, Verified has become a global communication movement, empowering people around the world with science-based information, countering misinformation, cementing vaccine confidence, and building momentum for a global response that leaves no one behind. A key reason for its success has been the use of approaches and strategies based on behavioral science. And we have leveraged learning, partnerships, and networks, developing tailored approaches using evidence-based tactics to reach the most vulnerable and impacted communities. And some of the key findings from the work that we have done over the last 2 years is the following. We discovered that providing localized content to partners in local languages using micro-influencers was much more effective in reaching communities and vulnerable parts of it than mass messaging that would come from us directly. we had to ensure that the content is culturally relevant, contextually appropriate. Effective co-creation with communities can help amplify influence through engaging campaigns. An example of that is something that we worked on in South Africa, where young people were very hesitant to wear masks, to social distance, to later on take the vaccine. So the campaign was, because they did not believe that the virus would impact them, that they are immune or it would be mild. The campaign was called Zwakala. Zwakala means I do it for you. And the notion behind it that young people should start thinking about doing the social distancing, adopting safe behaviors for the ones they love. And that was a very successful campaign. So we implemented it in one part of South Africa. Subsequently, the Ministry of Health adopted it and applied it throughout the country. We also discovered that interventions based on behavioral science can cut the noise and slow the spread of misinformation. We started with take care before you share, a hashtag and a moment asking people to take care before they shared anything, and then followed a few months later with a pledge to pause. The disruption of the emotional responsiveness engages rational thinking and reduces the spread of misinformation. MIT research group study showed that exposure to pause content significantly reduced the participants' propensity to share fake headlines. And that is a study that we did in 3 countries, but I think the principles apply to wider than that. And now we are working with behavioral scientists to identify further interventions and campaigns that could be tested to decrease the likelihood of inadvertently sharing misinformation on social media. We also looked at a third finding is that declining institutional trust means that increasingly established institutions like governments, the United Nations, must learn how to step back and be invisible. So we developed unbranded content, unbranded memes, GIFs, and others that then put out by some of those micro-influencers that I mentioned before, and then we saw how they spread much further than they would have if they were associated directly with us. New emerging platforms are hotbeds of viral content that we should not overlook. And as we saw during the pandemic, TikTok it increased multiple fold. The most downloaded app in 2020 was TikTok. So we proactively engaged with that platform, not directly through the UN channels, but we identified scientists who were working on the vaccine development, and we created something we call Team Halo. And those scientists were given training to how to use TikTok and to do campaigns, and they became an important counter narrative about the vaccines and showed how vaccines are made and increased the sort of uptake and confidence in those vaccines. And their messages were personal and conversational. Of course, we now have COVID-19 fatigue, so we also have to find other ways of reaching people. So we, in Brazil, we teamed with groups there, and we used carnival, sports, and music to convey the messaging, again, about the importance of changing behavior to protect those that we love and we care for. Other messages that we did through Verified, not necessarily about misinformation, disinformation, but also to end this pandemic, we need vaccine equity and we need solidarity. So that was Only Together campaign. That was in 2021. And we partnered with private sector companies to also encourage them to support COVAX and providing vaccines to countries where they were not available. So we're continuing to partner on how best to translate the results of research into actionable and easy to use tools. So what I spoke about is our effort to tackle the disinformation, misinformation about COVID, but the principles are the same. We are going to continue with Verified beyond the pandemic and use the same principles to also talk about misinformation on climate, hate speech, and other issues that we as a department are tackling. So I'll stop here and I'll stay on for questions towards the end. Thank you.
Great, thank you very much for those remarks, Maher. It was really interesting to hear how some of the work already across the UN system we can reflect upon in our efforts, and be curious to hear what our panelists have to say about some of this work as well. But for now, let's go over to the panel. So first, I'd like to speak with Ralph. Ralph Ridgwick, could you please turn on your camera? To get an understanding from an academic point of view, not to speak for all of academia, but from your point of view, what are some major ways that behavioral science can really add value in addressing mis and disinformation? Given that this audience is largely UN practitioners, what would you say to that?
First of all, thank you very much for having me here, Mary. And it's what a wonderful and important topic. Now, I'm a behavioral scientist, but let me first say that behavioral science, of course, isn't the first discipline that has studied misinformation or disinformation. And there were other people who have very eloquently talked about the effects of misinformation. I just want to highlight one person, Hannah Arendt in the 1970s. Has very eloquently spoken about misinformation and disinformation, about lies, actually. That's how it was called at the time. And she, for instance, predicted that if everybody lies all the time, then what is going to happen is that nobody believes anything anymore. Now, that's a very clear expectation and prediction. And it was hard to test at the time, but today we can actually test that. And I think that's one of the things that we as behavioral scientists can do. We can look into the consequences of misinformation. And not only that, on top of that, which was also almost impossible to do at the time, we can today measure and document the dynamics behind the spread of misinformation. So we can actually say something about how big the problem is. And we can also say something more about why misinformation, for instance, is so attractive, why it seems to have, as some people have found, advantage relative to correct information. What is it? What are the qualia? What are the dimensions that make it so successful in the attempt to catch our attention? And last but not least, that would be another important contribution, is to actually think about all the things that Mayor has been talking about, namely, what are the policy-based interventions that we can implement in order to help people to deal with the spread of misinformation?
Well, that's very helpful to line it up like that and to think about some of the interesting nuances. It's interesting you mentioned everyone lies. What does that mean? And how does this, like, just think about like game theory implications of how do we actually tease this apart? How do we know who's lying or not? But so following on from there, to what extent do you think behavioral science can actually lead to improvement? So you mentioned some of the policy work and the potential for it to policy interventions. What do you think we could leverage from behavioral science, given what we know at this time?
Yeah, I mean, if you look more closely, and we already heard about some of the interventions, there is not just one or two interventions. There is actually, at this point, a whole set of interventions that have been studied. And I would broadly categorize these interventions in two categories. One is an intervention that doesn't necessarily try to improve people's competences to deal with misinformation. It often includes changes in what we call the choice architecture. So, for instance, we introduce what is called friction, making the sharing of information just a slightly bit harder, and thereby forcing people to pause and indeed to think about, do I want to share that or not? So I'm not changing people's cognition, I'm just introducing a bit of friction. I can also nudge people toward a goal of accuracy, which is another very low key intervention. But on top of that, I can also do other things. I can really try to think about what are the competences that citizens really need in order to deal with misinformation. To give you one example, one important competence that we should have is to find, for instance, to be able to judge the credibility of a website. If we face a website and hear about, say, climate change or any other topic like advice on Corona, then the question is that a reliable website or not? And how do I figure that out? And what behavioral scientists have shown is that people actually go the wrong way in doing that. We typically engage with the content. We do critical thinking. We analyze the content. We look at the surface features. We look whether the graphs look convincing or not. And this is not what fact checkers do. Professional fact checkers actually immediately step out of the website and basically try to find out who is behind the website and try to verify that by looking at other websites. So that's a totally different strategy than the ones that we are being typically taught at school, paradoxically. And that would be really forming a new competence and fostering a new competence in dealing with misinformation and false information. So in principle, there are two big strategies. One is really dealing with the choice architecture and making and prompting people to think about accuracy. And the other one is more thinking about bigger competences that we can develop, new competences.
Well, that sounds great and very promising potential opportunities for application. But I also know that it's not so straightforward when you go into practice with a lot of these things. So what are some challenges you think we should be keeping in mind when it comes to taking this sort of thinking and applying it in our work overall?
Yeah, actually, there is a huge number of challenges that we have to keep in mind. And let me maybe just mention two. One challenge is that we know, even though there are a number of interventions that have been proposed, we know relatively little about the long-term consequences of these interventions. So why they may work in a moment, and they may work for a week, and possibly, if we are lucky, for a month, but will they work in a year from now when we are dealing with totally different topics? And that's a question that is really has hardly been studied yet. So we need to think and look more carefully at the long-term consequences. There's another challenge, which is that this environment is so fast changing. I mean, think about it, a platform within a night can change important parameter of its algorithm. And suddenly the ecology looks very different. And we as behavioral scientists, we are always one step behind. So are the regulators. They are also one step behind this fast changing environment. And so one of the challenges for me really, and not just for me, for any researchers in this field, is also to some extent getting access to the data and getting access to the kind of experimental manipulations that the platforms do. So here's a big question, namely, to what extent should there be transparency as to the data that is being collected? And of course, behavioral science happens in the platforms. It's not just like the academics that work on the topic, but it actually happens, probably most of it happens within the platforms. But unfortunately, that kind of science is not open to the public. And here's a real issue that we need to talk about.
All very, very important, valid points. And it's really interesting you talk about the long-term implications. We've had all these lessons, potentially lessons learned with COVID, but then what does that mean? That's been over the last number of years. What does that mean going forward? And as Maher mentioned, we're thinking about taking some lessons to climate change into other spaces. How do we, to what extent can we do that? To what extent will it last? Lots of unanswered questions out there. And also interesting question when we talk about and we discuss behavioral science in the UN, we ultimately want to measure behaviors, not intentions, but actual behaviors. So getting at exactly that, you need the data to real world behaviors. So for those who've been in our webinars previously, this is exactly an example of what we've been talking about. We're not measuring attitudes necessarily or intentions. We want to actually see real world behaviors. So yeah, lots to think about here. Hopefully we can revisit some of this back in the Q&A. I think we could talk for hours just about this and all of the literature out there and how it's so fast paced, but thank you very much for this, Ralph. And
you're welcome.
We'll come back at the end
to
hear from you again. Thank you.
Thank you.
And next, I'd like to speak with Lindsay Gavin from Duke Center for Advanced Hindsight, who worked with UNICEF on this very interesting project in Kyrgyzstan. So Lindsay, tell us about this intervention and some of the methods that you used overall.
Sure. So my colleagues and I at Duke partnered with the country office in Kyrgyzstan to test the effect of an accuracy nudge. And in behavioral science terms, you might call this sort of adding friction to the process of sharing news on social media. And I should say that this was a replication of a study that was previously run by Gordon Pennycook and his colleagues on a population in the US. So we wanted to see if those same effects would hold true for a population in Kyrgyzstan who had been kind of facing a flood of misinformation around COVID. So participants, it was an online study, participants entered through an online link, and they were asked how likely they would be to share each of 15 true and 15 false COVID-related news headlines. And it asked about their sharing intentions on social media. But for half of the participants, they were first shown a neutral news headline completely unrelated to COVID, and they were asked to stop and think about the accuracy of that news headline. So an example of sort of the accuracy nudge headline was, I think we had one about Google opening an office in Kyrgyzstan, and it just asked participants, how accurate do you think this news headline is, before showing them the COVID related news headlines and asking about their sharing intentions. Now, we found that the sample in Kyrgyzstan, when they were being shown the accuracy nudge, actually did not decrease their willingness to share false headlines, nor did it increase their willingness to share the true headlines. So the results of the Pennycook study were that those who saw the accuracy nudge actually were more willing to share true headlines. That didn't hold in the Kyrgyzstan context.
Very interesting. And again, an example, first of all, doing any sort of work like this in countries like Kyrgyzstan is challenging. So congratulations on getting this effort off the ground and having data and results to say what you've shared with us today. And this is, again, something we talk about, not always interventions work in the field, and there could be many reasons why. So, what lessons did you learn from this, and what would you sort of take from this going forward for others working in the field, perhaps in misinformation or behavioral science broadly?
Yeah, so I think when we first saw the results of the Pennycook study and a couple of other studies, ourselves and the Kyrgyzstan country office were very excited to try to go out and deploy this accuracy nudge. So I think a huge lesson learned was sort of piloting, testing, experimenting on the population whose behavior you're actually trying to push. So we found that the sample of participants in Kyrgyzstan who we tested with were on average a good bit younger than those who were in the Pennycook study, potentially more tech savvy. The Kyrgyzstan sample overall was less likely to share any headlines at all than the US sample. So we were kind of working for a smaller effect size anyway, but those kinds of lessons are really good to learn, in that, just because some sort of nudge might work in one context, it's good to experiment and make sure that, there are population differences, and how does that nudge kind of translate?
Yes, of course. And there's so many things in here that come up in behavioral science projects all the time, whether it comes to the diagnostic and how do you understand the context. And that's a whole question of what that is and how to do that in different country contexts. And also looking at the segmentation, the different populations and what you're trying to infer. So these are all very important questions. And I think things that we can consider in work, particularly when it comes to misinformation. As you said, the younger populations is something to perhaps consider versus older. So there's lots here we could tease apart, but just very helpful overall. And then I just wanted to get your thoughts on the overall experience of applying behavioral science to address this topic in Kyrgyzstan, particularly with UNICEF. I know you worked on a variety of projects too. What was the experience overall for you?
Yes, so I can't speak for the country office. I know that some of our colleagues in the country office, it was kind of their first experience with behavioral science, and with certainly with some of the analysis methods that we used. But the country office were very, very willing to experiment. They provided a lot of support. There was obviously a lot of logistical support in terms of translations and back translations, and actually deploying the intervention. They helped kind of share entry to the study on social media through their different channels, and through sort of contact lists and things that they had. So even though the accuracy nudge didn't appear to have an effect in Kyrgyzstan, I think it was a really good experience overall, just how to set up a field experiment, and looking at different analysis methods that maybe haven't been used in the past there.
Yes, I'm sure there'll be some long-standing impact of your work, regardless of how things go. But thank you so much, Lindsay. This has been very helpful to hear about the UNICEF experience and kind of the work overall. So we'll come back in Q&A for more to discuss further. Next, I'd like to hear from Pampa Dubois from the US Government Office of Evaluation Sciences. Hi, Pampa. Great. Thanks for joining us. So as mentioned, I think you can talk about the Office of Evaluation Sciences if you would like overall, because I think it's an interesting initiative that's been going on for a number of years now. But in particular, could you tell us about your work at the Surgeon General's office addressing misinformation? Be great. Thanks.
Yeah, sure. Thank you so much for having us here today, and good morning / good afternoon to everyone. So my name is Pampa de Broy. I serve as a behavioral scientist in the Office of Evaluation Sciences, and we are based at the U.S. General Services Administration. So we're a resource across government to different agencies working on different priorities. So as Mary mentioned, we've now completed over 100 rigorous evaluations with dozens of agencies, and we try to bring a behavioral science and social science lens into the work that different agencies are doing. And in the health arena, we focus on federal programs typically related to patient and provider behavior, as well as things like enrolling in health benefits. So I'm happy to be here today to share some of the ways that our team of behavioral scientists could contribute to this effort around misinformation. So last year, our team at the Office of Evaluation Sciences started working with the Office of the Surgeon General to support their work combating health information. And many of you may be aware of the role of the Surgeon General. It's to be the nation's doctor. So the Surgeon General provides Americans with the best scientific information available on how to improve their health and reduce their risk of illness as well as injury. And the Surgeon General works to bring this scientific information to the public. And they do so by issuing advisories, calls to actions, and reports on critical issues, and by communicating directly with the public through various communication channels. So last July, the Surgeon General issued an advisory that warned the American public about the urgent threat of health misinformation. And they called for a whole of society approach to address health misinformation during the COVID-19 pandemic and beyond. And the idea behind an advisory like this is to call the American people's attention to a public health issue and provide recommendations for how that issue should be addressed. And these advisories are really reserved for really significant public health challenges and threats that demand the American people's immediate attention. So it's a communication tools, but it leaves space for a more user-friendly version, something that community leaders can use in their communities. And so this is really where the behavioral scientists at OES came in to support their work. So they came to us with this idea about how to turn this advisory into something much more actionable that people can actually use and act on. And we iterated on their initial ideas to identify, what is the audience here? What are the goals? What is the format? And in this case, decided the audience was healthcare providers, educators, librarians, faith leaders, trusted community members. So a pretty diverse set of stakeholders and folks. And the goal was to create an accessible and practical resource that builds off the advisory and is aimed at a broader audience. And really to understand, identify, and stop the spread of health misinformation in the communities. And the format we used was a toolkit. And so that's where we were trying to think about what are the possible behavioral interventions and touch points in this. And thought about questions like what we add or cut or edit to ensure that the toolkit is accessible and approachable for a broad range of users. And how might we ensure emotional resonance for the users? So I'll share a picture of the toolkit. And I think if you have a chance to look at it, you can see right away they have really talented graphic designers as well as user experience designers within their team at the Office of the Surgeon General. And these are people that are used to thinking about how to present information in ways that people really understand them and emotionally relate. Well, we, OES, tried to bring our perspective on the literature. So what has been demonstrated to be true in previous studies and how can we apply it here? And here, let me actually show this slide. Okay, can you see my screen?
Yes,
So this is our current Surgeon General, as you'll see from their from the photo, and they, as you see, have a lot of interesting graphics, and we tried to kind of come in with a behavioral science lens to make it more approachable. And so this is kind of what we did. Research in the social and behavioral sciences has shown that people are prone to unknowingly share false information for a variety of different reasons, and this is described in the toolkit. So like it's listed here, we like to feel that we have new information that others don't know. We want to protect the people we care about. We may be seeking explanations or want to share information that helps us to make sense of different events. And we want to feel connected to others. So this toolkit basically provides information and exercises to help people recognize false health information and also be able to talk about it effectively with others that are prone to spreading misinformation.
Great, thanks for that, Pamela. There's lots of interesting examples there. So interesting elements of behavioral science you alluded to, kind of all the different prompts, as well as the messengers, and even getting at what Ralph was speaking about earlier about competencies, like how to actually equip people with ability to look at mis and disinformation. But a question regarding some of the lessons learned with respect to your work. So what did you learn about why people are prone to unknowingly share false information? Do you have specific things that you found in your work and your research?
Yeah, so that's kind of what we listed before. So we want to feel like we have new information that others don't know. We want to protect the people we care about. We may be seeking explanations or share information that helps us to make sense of the events, and we want to feel connected to others. And so really what we tried to do is provide tips for community leaders and individuals interested in learning about how to talk to others who are sharing misinformation. So maybe I'll kind of go into what we learned, which is try to listen to people's fears and why they believe what they do. Empathize with the fact that there are often reasons why people find it difficult to trust certain sources of information. Point to credible sources who are not in a position to personally profit or to gain power or influence. Don't publicly shame and have conversations one-on-one, either face-to-face or via direct messages on social media sites. And use inclusive language that makes it clear that you see yourself being impacted in the same way. And so our job was to kind of point to what works in the literature and help really make this toolkit as actionable as possible.
Great, no, that's very helpful. I think there's lots there we could pull apart, but just in the sake of time, I think we're going to save that for the Q&A. I think there's more to had there, but I'd like to call all of the panelists and just back to turn their cameras on. Great. And while they're doing that, I'll just sort of load up with a question that I want to ask all of you. Maybe we can go in the order in which we spoke, just to have a bit of structure to this, and Maher, then Ralph and Lindsay. And feel free to reflect, bounce, but comment on each other's responses as well. Don't need me to come in. But so now that we've discussed behavioral science and misinformation from all of these perspectives, from the UN, from government, from academia, what can we learn from this? Where can we go from here? So what could we be doing in terms of actions to work better collaboratively, to work better from our own standpoints and vantage points? What would you say we could be doing collectively to improve the current state? So Maher, start with you.
Oh no, thanks. I think what is evident for me has been for a long time is that science works. We are able to have this webinar and speak to each other because science created these tools. We have developed vaccines in less than a year because science and research pays dividends in progress and in a proven ability to solve problems. It makes mistakes sometimes longer than we need, but we have to trust in science. And behavioral science is a science. And we know that actually some of the marketers and marketing communication is based on, the research, what works, what doesn't. And we know from films like The Social Network that that's what these big platforms are doing. They are studying behavior, and they are basically trying to keep you on those platforms as long as possible so that they can sell your time and minutes to companies, to markets. So if the private sector is using that and others, and people with certain agendas are using behavioral change or influencing through misinformation, disinformation, we have to become better at that. And I think that's what we have discovered, that working with experts from outside the UN, whether it's Purpose, the social impact company agency, or researchers in MIT and other places, and now we're working with Oxford University researchers and others, is something that we have seen delivers better results and reaches a much further audience than we normally do. We just have to do more of this.
Completely agree. Yeah, lots of partnerships across academia and the UN could be helpful. But Ralph, I see you wanted to come in.
Yeah, I actually want to build on what Mayor said, and I think where I'm a bit more cautious, even though I'm a behavioral scientist, a bit more cautious is that I do think that this is a problem that requires more than one solution and more than one discipline to approach it and deal with it. And what I have in mind is that we need actually the concerted effort of regulation. We need also the contribution of the platforms, and Mayor just described, there are particular algorithms that are built to increase our engagement. And for instance, if you look at the spread of disinformation, of course, we all contribute to it, but there is also an identified group of super users that are reinforced to spread false news through the algorithms itself. They become a lot of voice and a huge impact through the algorithm. That means that we have to also talk about the civic responsibility of platforms. And last but not least, of course, we as behavioral scientists have to contribute to the solution. And we can do that not only through the interventions itself, but for instance, we can also help to build smarter regulation. So regulation itself is not just a legal issue, but it's one that should also be behavioral science evidence-based. So in this sense, I think we as behavioral scientists have to contribute a lot, but it's also clear that other forces need to be joined in order to actually solve that problem. And we certainly shouldn't allow the platforms. And if I look at this round of people here, there is no representative of a platform here, which is kind of odd, because the platforms, of course, play an enormous role in the problem of misinformation, and we need to talk about that as well.
Yes, definitely. We need to have a broad discussion, bring everyone in. So we did communicate with some of the platforms to join us today. Unfortunately, they were not able to do so, but hopefully in upcoming discussions, we can have further just conversations with them and be able to work collaboratively together.
And Mayor, if I just can reinforce what I said earlier, a lot of the behavioral science, we need to be aware of the behavioral science happens in the platforms. And unfortunately, this is typically not transparent to us, to the public, and to the scientists in academia. And that would be great to be able to work more collaboratively here.
Yes, definitely. We'll try our best, and hopefully we can continue these discussions with you and others to see ways we can do this. Lindsay, what are your thoughts on where we can go from here?
I completely agree with that last point regarding the platforms. I think there's a need for that collaboration and at least having those conversations. I also think a lesson that we're learning as we kind of continue misinformation studies here in the US is recognizing who isn't in the room when you are designing interventions. And oftentimes, in our experience, a lot of times that is people who are spreading misinformation, people who are, users of of social media for their news. And so recognizing that bringing some of those folks into the design process is really important, is something that we're trying to do a little bit more of here. And then also understanding sort of networks. So who in an individual's life is it that influences their attitudes and their behaviors? Is that their close friends, their family, their government, their religious leaders, their neighbors? So trying to sort of understand the network science behind why people feel the way that they do and some of the attitudes that they form around behavior.
That's very interesting. I think that means we should be having many more people a part of these conversations, not just us at the table. Then we should be thinking about broader individuals. And I like that you've echoed kind of Pompa's remarks about this empathetic, like really being a good listener and really trying to take a deep understanding of the context and what's happening for certain individuals. So great to hear some of the messages coming around. And yeah, Pompa, what are your thoughts?
Sorry, after 2 years, you'd think I'd be able to unmute. So thank you. Yeah, I agree with everything that's being said. I think taking an interdisciplinary approach to understanding the problem is incredibly important. And one of the comments in the chat I also thought was really informative, that, you know, us just thinking about this on our own from academic lenses and designing something that's well designed isn't as important as really also getting it out and making sure that people are using it and sharing it and reading it. And so I think the utilization aspect and the dissemination aspect is something that's also incredibly important. And I think, Mary, hosting chats like this is important, but also, you know, as Lindsay and others have said, bringing everyone together, bringing audiences together, getting this out in multiple ways from different people, and not just the folks doing the work and not just the agencies, but really getting folks in the community involved and being able to spread and disseminate the work that's being done.
Yes, all very important points, and thinking about all the different stakeholders, I think it just, yeah, and the networks, you start to reflect upon it, gets to be quite large. So this has been very helpful. Okay, so we only have a few minutes left for Q&A, so I want to get to a few questions. So the first few I'm going to ask are a little bit technical, so academically technical, so perhaps I'll direct them towards Ralph, but if anybody has any other comments from the panel, I'm sure you probably do as well, given you've been working in this space. But there's a question from Matab regarding an example you could cite where behavioral science has successfully tackled mis and disinformation around a major public issue like climate change or vaccine updates. So maybe a bit more concrete example of what you were talking about earlier, Ralph, kind of very specific. And then just building on that, another one, if I can piggyback to, is the topic encouraging people to check credibility. So you mentioned this idea of checking content, so lateral reading, to reduce the sharing of misinformation. How effective is this, the type of intervention? And if people have different perceptions of what counts as credible. So just kind of reflecting on the literature there, what your thoughts might be on those two questions, Ralph, and any others.
I mean, that's a very good question, and that's a question that holds more generally for all the interventions, namely, what are the effect sizes? And that we also need to talk about. So it's not just the issue of how long lasting the interventions are, but also how big the effect is. But there's an interesting issue here, namely that these interventions typically scale up. So in other words, we are not just reaching one person, but we are reaching millions, possibly billions of people through the interventions. And so even if there's only a small effect in one person, through the fact that we can scale it up, and ideally that it's a long-lasting intervention that not only works once, but many times, we will still have substantial effects that make a difference. So this is an interesting methodological debate, but it's only at the very beginning. So we are only understanding the interventions. And In that sense, let me also answer the first question that you raised, and that's an important one. Can we able to point to a particular interventions that has really solved or dealt with a major health or other problem, global problem? And I would say I would be careful making too strong a claim, but that's obvious. It's obvious in the sense that we are only in recent years have understood the problem of mis and disinformation in the digital world. And we only recently have started developing interventions. I mean, some of the interventions are as new as a year or 2 years. So we are still in the process of trying to design them better, understanding their effect sizes, and then also trying to roll them out, because typically they are being studied in the behavioral labs, but that's of course not good enough. We need to also roll them out, and that requires to some extent the interaction and then the collaboration of the platforms, or we need to find other ways through public health agencies or other infrastructures that help us to roll out these interventions. So at this point, I'm optimistic that we will be able to show that in the future, but right now I don't think we can yet claim that we have really changed one of the great crises of the present. But that's not too surprising given how new and recent this research field is.
Yeah, no, that's very interesting. It's an exciting time to be in this space, but also a bit of uncertainty around what we know. So
yeah, and I would say it's fascinating. It's a fascinating research field. Being a behavioral scientist at this point is really wonderful. But I think that in a few years we will see much clearer what works and what doesn't work.
Mm-hmm. Very interesting. So even if you don't work in this area, watch the space and keep on top of the behavioral science work. Anyone else to comment on those questions, or I can go to a few others, are a little technical. Okay. So there's a question I have here for Pampa. What do you think, how did you disseminate the toolkit to encourage use? And do you have any data on the efficacy or impact of it overall? And then one that maybe touches on what Lindsay had said earlier regarding the different segments of society and how that can impact the influence of your intervention. So we know that maybe successful behavioral science application of nudges and pauses could be successful for certain people. You know, do we know anything about people who are undecided or open-minded? Do you have any recommendations regarding data interventions or for any kind of research overall for those who are more firmly entrenched in their views? So targeting interventions to those who maybe I think it would be harder to convince. So hopefully that was clear. I can clarify if you need, but Pampa, Lindsay, over to you.
Sure, thank you for that question. So in terms of the dissemination of the toolkit, I think this was shared publicly on the CDC website. It's shared through various channels of communication. Unfortunately, I was not directly involved in the toolkit, so I can't speak too much to the dissemination, but I'm happy to follow up on that piece of exactly what channels were used and how they track who's using this. But I completely agree that that's an incredibly important part of designing and getting the toolkit out there. It's not just creating it and putting it on the website, but it's really making sure that it gets into the hands of people that will use it and shared on social media and through other platforms.
Great, thanks for that, Pampa. Lindsay, so I also see there's another question for you. If you don't mind, I might ask you another one as well. So there's one that's directly about how you adapted to the Kyrgyzstan context as well. So thinking about the segments of population, how did you go about reflecting on that? And then also, what did you do? What process did you go through to thinking about the study that took place in the US and adapting to the country context?
Yeah, honestly, I think one of the lessons learned is that we probably didn't adapt enough to the country context. So because we wanted to run this close to a replication, we actually used a number of the same headlines that Gordon Pennycook and colleagues used in their study, filling in any that were outdated or had sort of shifted position or certainty to try to make it very clear or very apparent, at least to us, which were true and which were false, because there are elements of misleading versus flat out false. And so we did change a number of the headlines that had become outdated, but especially for like false headlines, we still found a number of those from American-based websites like Snopes, factcheck.org. So there were probably some misinformation rumors and things that were going around in Kyrgyzstan that we just weren't aware of and didn't include in the study. And we did have our colleagues in the country office review all of the headlines, obviously reviewed them for translation. We ran the study in both the Kyrgyz language and in Russian, so that people who entered could decide which language they wanted to take the study in or take the survey in. So I think that we made some effort to sort of adapt to the Kyrgyzstani context, but probably not enough. I know that the question in there refers to like collectivist versus individualized. We probably could have done more to make some of the headlines a little bit more relevant.
Yeah, that's really helpful to break down your process though. I mean, it's never the same. Each behavioral science project, there's different ways you can look at the context, but yes, it's obviously very important to talk to local individuals and to really dive as deep as you can, especially in this really nuanced area that is mis and disinformation. All the pros that come with the algorithm able to change the choice architecture also comes with some of the challenges that you really need to know your context well, because some of these small changes can have potentially a larger impact. So in the few minutes we have left here, I have a few questions for Maher, but also for the larger panel. So there was one question with respect to from the overall challenges of UN, academia, and other organizations working together, and particularly the issue of climate change. And what are some of the more practical challenges when it comes to thinking about that overall? Thinking about individual countries, media, creating information that resonates across. I mean, you mentioned climate change would be something you're looking forward to in the future. So teasing that a little bit more would be helpful. And another one for you, Maher, is you mentioned sports as a way to spread message. So which sports did you use and what did you learn from that experience?
Thanks. I mean, just quickly, I think to go back to something Rolf said, regulation is of course, I think is paramount and important. We all think behavioral science is not going to solve the problem, but we have to do everything we can. Behavioral science, our communication, but regulation is important. Tackling the platforms themselves is also paramount, and we have done that. We engaged with the top leadership of the major social media companies, and to some extent WHO did the same, and they have actually sometimes taken up and developed new content, regulation, and we see that. Is it enough? Not necessarily. That's why we need also behavioral change. People need to learn how to check the date, check the fact, who sent it, is it really relevant? Do I want my name? So these are the critical questions that people need to ask when they are there. On climate change, there are still people out there who don't believe in climate. So we have to come up with innovative ways to reach them. And in terms of we have a campaign called Act Now. So what we promote is that people can go and visit the website. There's an app they can download. There are about 5 million people have already committed to 10 actions that individuals can take. Does this mean that will solve the problem? No, but it is in addition to them becoming advocates for climate change with their leaders. Leaders, and I mean leaders in government, but also leaders in the private sector, because we can vote in the elections, but we can also vote with our wallets. So this is also important, that companies, pension funds, large investment need to move away from fossil fuels. And some of you may have seen an innovative campaign when the dinosaur came to the General Assembly and said, don't choose extinction, time to move away from fossil fuel subsidies. So that's a UN campaign that really builds on popular culture, love of dinosaurs, and then the idea of a dinosaur coming to tell us, we were killed by a meteor. What's your excuse? You're poisoning your own atmosphere. So there are ways that we are tackling climate change, but of course, I have no illusion. It's not an individual behavioral change. It has to be regulation. It has to be both government, private sector moving together on that. On the question on sports, at the time, it was the Olympics in we were approaching the Olympics, and in Brazil, there's a big passion for sport. There are also teams that are supporting. So it was a hashtag, each one of us, or a hashtag, one single team, basically inviting the different supporters, national supporters of Brazil's team in the Olympics to spread messaging about, look at your team and how they are adopting measures to protect themselves and the other players. So let's do that in our community. So using the messaging with the WhatsApp groups and with simple hashtags, simple examples of its behavioral change. You know, there's still a pandemic, keep your distance. There's still a pandemic, wear your mask when in closed place. If a vaccine is available to you, go and take the vaccine. So that's the kind of way, whether it's a sport or a festival. So we are now actually talking with the sporting world, with the football. We're about to launch a campaign, and you've heard it here first publicly, called Football for the Goals. How the world of football, we're coming to the World Cup, where 3 billion people start watching, to promote the SDGs, and how do we really get to 2030 with a guaranteed achievement.
Great, thanks for that. Lots of different potential messengers to employ in this work. So I see we've reached our time here, but if there are any last final comments from our panelists, I'll give you some space. But if not, we can also close down for our hopefully continued discussions as we bring in more partners into this discussion we're having. So anyone like to come in and say anything? No? Okay, well, that's great then. Thank you very much for joining us. Really very much appreciate your time and your effort to share your work with us today. Looking forward to continuing this conversation. And with that, bye for now, and hopefully see you soon. Okay, bye everyone.
Bye, thanks.
Bye, thank you very much.